my back originally about 32 years ago when I was playing very competitive basketball, and I gave that up and went to handball. So I've been playing handball 2, 3 times a week ever since, regardless of my back issues. Mostly I would wake up in the morning and my glutes would be very painful, and I would get some ice and sit on ice in the morning before I went to go teach. I started a couple of years ago having some numbness in my toes. And then the third thing was and is that my left calf atrophied because the nerve wasn't firing.
The reason Mr. Marksberry had the pain in the gluteal region as well as the numbness and the atrophy in the legs was because he has a squeezing spot in the spine where nerves are pinched. Not just one nerve as it exits, but the whole bundle of nerves as it passes through the spinal canal. When you stand up or walk, these nerves are compressed worse than when you're sitting down. If you sit down, it actually creates a little bit more room in the spine. What the Vertiflex does is to push against the bones in the back part of the spine behind the spinal canal to hold these bones in a position as if you were sitting down, even when you're standing up. This has allowed Mr. Marksberry to get back to his usual activities, including handball.
If you look at they have what they present as an 85, 86% effective rate. So that was the first thing. The second thing, I realized that it was an outpatient procedure. I realized that the incision was very small. I understood what was going to happen. I saw the device, very small, about the size of a dime. They would wedge it in the 2 vertebrae that are compressed and then open it up. And it just makes sense. It's purely logical. So the procedure itself is about 30 minutes and then anesthesia prep ahead of time coming out of it. That rest of the day, I was kind of numb. But the next day, which was a Thursday, I teach. I'm a professor at Tulane, and I went to class and I stood up and I taught for 3.5 hours.
What is typical is return to one's usual level of activity, usually within a week. Sometimes it takes 4 to 6 weeks, but the recovery time depends on how severe the symptoms have been and how long the symptoms have been allowed to go on.
Truly, I can't believe how easy it was, number one. And he shocked me when he told me I could do whatever I wanted after a week.